from 1 month ago, and there are currently 261 people hospitalized because of COVID-19. 83% of our ICU beds and 87% of our acute care beds are currently being utilized in the city. And we have now reached a very solemn number. We are over 800, with 807 Baltimoreans losing their lives to COVID-19. This evening, Baltimore will join a statewide commemoration for Marylanders lost to COVID-19 by lighting the City Hall dome amber. The 807 lives we've lost here in Baltimore are not just numbers. We have to remember they are family members, friends, and neighbors. They are people that will never be able to celebrate holidays, birthdays, just good times in Baltimore with their families, eating crabs with their families. That's what this is about. These are not numbers. These are about people and communities that are deeply impacted by this pandemic. And as we continue to battle this pandemic, we must keep in mind that the actions we take are about the health and safety of our residents and fundamentally protecting the lives of those who we love. We update our executive orders based on trends in the city's COVID-19 reopening indicators, which you can always see at coronavirus.baltimorecity.gov. This is something Baltimore City has done throughout the pandemic, and we will continue to do. This has included at times reopening different types of establishments while providing clear guidelines, including the use of face coverings, practicing social distancing, and other relevant guidance. With that being said, as has already been reported by some of the members of the media, my February 22nd executive order has been revised. The minor updates to those mandates will take effect at 3 p.m. today. You can see this order and all other past orders at baltimorecity.gov and click simply on mayoral executive orders. The city will continue to enforce this executive order, and establishments allowed to open must follow all relevant health and safety guidance from the CDC, State of Maryland, and the City of Baltimore. I will now turn it over to our Health Commissioner to speak about vaccine distribution plan for the week ahead and discuss our efforts to equitably respond to the pandemic here in Baltimore. Dr. Jiraza.
Good afternoon, and thank you, Mayor Scott, for your continued leadership during this pandemic. I'd like to briefly share data on our key COVID-19 metrics. As of this morning, as Mayor Scott mentioned, we have lost 807 lives to COVID-19. We've had a total of over 40,000 cases, and our latest 7-day average new case count is a little over 92 new cases per day, a more than 39% decrease from where we were 4 weeks ago. Our latest 7-day average positivity is 2%, a decrease of 42% from 4 weeks ago. And as Mayor Scott mentioned, our hospital utilization rates have decreased. Fatalities due to COVID-19 are now averaging slightly more than 3 deaths per day. Switching gears to discuss vaccination efforts, the Baltimore City Health Department and our healthcare partners have reached 13.3% of the city's population with at least a first dose of the vaccine. In total, that's 78,934 city residents having received their first dose of vaccine, and 45,804 residents have received their second dose. Moving forward, Baltimore City's COVID vaccine data dashboard, hosted at baltimorecity.gov/COVAX, coronavirus.baltimorecity.gov/COVAX, will now include the city's data showing the county of residence for individuals who have received vaccine at any vaccination site here in Baltimore City. In order to ensure equitable and rapid vaccination of Baltimore City residents, the Health Department is continuing to work with our healthcare partners to direct doses specifically to older adults, educators, first responders, and people experiencing homelessness. Next week, we will be utilizing our doses in the following way. 1,200 doses will be reserved for Baltimore City residents over the age of 65, our city educators, and first responders at our Baltimore City Community College closed pod site. Health Department staff are in the process of reaching out directly to older adults to schedule appointments using our MAP call center, as well as the Google Interest form registry that our older adults have completed. As a reminder, eligible older adults over 65 are encouraged to call the MAP hotline at 410-396-2273 to register their interest in receiving a vaccine when it's available. So far, we've recorded almost 20,000 responses from adults over the age of 65, with more than 50% being managed internally or referred out to healthcare partners for appointments. 1,000 doses will be reserved for clinical partners operating their own closed pod sites serving the same older adults off of our registry, as well as city educators. 1,000 doses will be reserved for our mobile vaccination clinics serving Baltimore City older adults living in senior housing sites and individuals experiencing homelessness living in congregate living settings. The health department is continuing to scale up its successful mobile vaccination clinics alongside our healthcare partners, using the city's allocations of doses to bring vaccine directly to older adults in senior housing buildings. We are prioritizing buildings based on the total population of older adults living in a building and the vaccination rate of that building's census tract. This ensures rapid coverage to densely populated buildings and areas with low vaccine coverage to date. To date, the health department has identified 117 independent living facilities housing an estimated 14,000 Baltimore City residents as a part of our mobile clinic vaccination efforts. Buildings within city limits that house at least 30 adults over the age of 65 may request a clinic on an ongoing basis through an online interest form found at coronavirus.baltimorecity.gov/COVAX. Baltimore's COVID-19 vaccination rollout has been an all-hands-on-deck effort, and we again are grateful to our partners at MedStar Health, Johns Hopkins Health System, Johns Hopkins School of Nursing, LifeBridge Health, and Safeway Pharmacy, who have all played a vital role in reaching Baltimore City's older adults where they are as a part of our mobile vaccination clinic program. Of the 117 buildings identified, 54 have already had first dose clinics, with the health department providing 14 of those first dose clinics so far alongside our partners. Second dose clinics have also begun at locations that have received their first dose as well. The number of clinics that we can host is dependent on our weekly vaccination supply, and moving forward, we will begin releasing information about our schedule for mobile vaccination clinics for the upcoming week. Next week, working with our partners, we will be visiting Bolton North Apartments, Hanover Square, Marlborough Apartments, St. Mary Apartments, Roland View, and the Zion Towers. We will also be returning to Advent Senior Housing Apartments and to Sharp Leadenhall to perform second doses for those older adults vaccinated in February. On February 27th, the FDA approved an emergency use authorization for the Johnson & Johnson vaccine, bringing a third viable vaccination option for Baltimore City residents. The Johnson & Johnson vaccine differs from both the Moderna and Pfizer vaccine in two significant ways. First, unlike the Moderna and Pfizer mRNA vaccines, the Johnson & Johnson vaccine is what we call a viral vector vaccine, made from inactivated adenovirus. This is the same virus that causes the common cold. Because this virus has been inactivated, it will no longer cause infection. The Johnson & Johnson vaccine does contain a piece of DNA that instructs your body to make the COVID-19 spike protein. This is what your body ultimately recognizes and uses to develop a defense in the event you are exposed to COVID. Like the other vaccines, the Johnson & Johnson vaccine does not contain live coronavirus, and you will not get infected with COVID-19 after receiving the vaccine. None of the vaccines approved by the FDA alter your DNA in any way, and none of these vaccines insert any type of tracking microchip into your body. The second key difference with the Johnson & Johnson vaccine is it is a one-shot vaccine, so there's no need to follow up for a second appointment. The vaccine itself can be stored at normal refrigeration temperatures with no need for special freezers. Side effects for the Johnson & Johnson vaccine include soreness at the site of injection, chills, headaches, body aches, and/or fatigue, and this usually lasts about a day or two. These side effects are common and indicate that your body is mounting the appropriate response in the event you're exposed to COVID. Many have reached out regarding the news of the new vaccines, with questions coming up around the efficacy, or loosely the effectiveness, of the vaccine. I'd like to be clear with all city residents on this point. Having a vaccine is better than no vaccine. All of the vaccines have been proven effective at preventing serious illness, hospitalization, and death from COVID-19. Having different types of vaccines available for use especially ones with different storage and handling requirements as well as dosing requirements, can offer more options and flexibility for local jurisdictions and vaccine providers. Additionally, the Johnson & Johnson vaccine has been tested and shows efficacy against the Brazilian variant of the coronavirus. While we will be putting out new graphics, frequently asked question documents, and PSAs in the coming weeks to go into more detail about the J&J vaccine, at this time we are confident in the safety of the vaccine and encourage residents to get any vaccine they are able to secure. While we continue to talk about the importance of receiving the vaccine when it's available, we are also noticing a slight decrease in the number of individuals seeking testing for COVID-19. Testing for COVID-19 remains a vital component of the overall pandemic response, and we still encourage residents to get tested if they're experiencing any symptoms suggestive of COVID or have been in close contact with someone else with symptoms suggestive of COVID. Our mobile clinic testing is posted weekly on our social media accounts and on our website, coronavirus.baltimorecity.gov/testing. Additionally, please remember to pick up the phone when MD COVID calls, as our contact tracing programs also remain as vital as ever to quickly identify and reduce disease transmission. As always, please continue to wash your hands, wear your mask, socially distance, and reduce your contact with others to slow and stop the spread of disease. Thank you.
Thank you, Dr. DeRaza, and for all of your great leadership. I want to take a moment to thank our health department for the ways that they continue to make sure that the vaccines we receive from the state make it to our most vulnerable population. This includes, as you hear from Dr. DeRaza, our mobile vaccination strategy, which has been able to reach our residents who live in public housing, people experiencing homelessness, and people with limited access to transportation, and of course our older adults. I want to lift up our partnerships with our amazing hospitals who continue to serve our residents who are older adults, supporting them and addressing barriers to getting the vaccine. To that point, I want to remind everyone about the MAP call center line. Our older adults over the age of 65 can call the following number to be matched with an appointment for a vaccine when one becomes available. The phone number is 410-396-2273. That's 410-396-2273. As of today, more than 19,000 older adults have called to get in line for an appointment. And at this stage, our team has done an amazing job matching nearly 12,000 older adults to available appointments. Earlier this week, on Tuesday, Dr. DeRaza and I hosted a telephone town hall for older adults. We reached over 3,000 older adults and answered questions about how to access appointments and everything else around the COVID-19 vaccine. What we heard was a lot of people say they are ready to get this vaccine now, but are struggling to access appointments. Baltimore remains ready in partnership with the health department, fire department, the Office of Emergency Management, and the National Guard to scale up our efforts to get our residents vaccinated as quickly as our supply allows. I want to continue, and I do continue to be heartened by the news that we're hearing out of Washington with the Biden administration, and I look forward to the ways that the scaled up production of vaccine will mean more appointments for Baltimoreans. Lastly, I'd like to speak about the importance of COVID-19 testing. We are nearly a year into this pandemic. We are seeing the rates of testing go down, and now is not the time. We have to continue to get tested. We know we're all tired. Everyone's tired of having the thing in their nose, but you have to. In order for us to make it through this in the time that we all want to, getting tested is just as important as getting the vaccine. You're doing it to protect yourself and those around you. According to the CDC guidelines, the following people should go and get a COVID-19 test: people who have symptoms of COVID, people who have close contact within 6 feet or for a total of 15 minutes or more with someone positive for COVID-19, people who take part in activities that put them at higher risk for COVID-19 because they cannot socially distance as needed, such as travel, attending large gatherings, or being in crowded indoor settings, and people who have been asked or referred to get tested by their healthcare provider, local or state health department. Again, this pandemic is still very real, and people still are dying. As you heard me say earlier, we're now over the 800 mark. Let's continue to take this seriously and do our part to stop the spread of COVID-19. Now, I want to pause here and speak very clearly about something. Yesterday, we had 2 more children shot in the city of Baltimore, a 17-year-old and a 15-year-old. This was, of course, after Commissioner Harrison and I spoke with you earlier this week about the levels of violence in the city, especially around children, and what we have experienced this year. I'm going to give the commissioner a second to come up, but I think I want to say this again, that we cannot accept this. These are babies, and we have to understand that these are children. No matter what was said or what was done, they're children, and children have to be treated differently than adults, especially when you're talking about the life or shooting or harming a young person. And I'm going to come back up, but I want to start off by setting the tone there first to understand that we're talking about babies here in Baltimore. And Commissioner Harrison, please come forward.
Good afternoon, and thank you, Mr. Mayor. Certainly the levels of violence involving children that we've seen over the last week continues to be extremely frustrating. These incidents of gun violence involving our children are not just shocking, but they are horrifying and they are angering. Our department is working aggressively to identify those responsible and bring them to justice for these senseless acts of violence. And detectives continue to follow investigative leads, some of them very promising, as we look to identify and we look to apprehend potential suspects. What we know at this time is that 3 of our young victims were targeted, meaning someone actually was looking for them and went after them to harm or kill them. All of these incidents speak to the perpetuating culture of violence in our city, to include the easy access of guns by criminals and their desire and willingness to use these guns to solve conflicts. We remain laser focused and committed to using every resource available to us in the Baltimore Police Department to identify and arrest those responsible for violence in our community. To that end, we need your help. We absolutely know that there were people present at these times and at these locations when these incidents happen. Again, we are pleading with members of our community. If you have any information that will help us solve any of these cases, please call police right away, or you can call anonymously Metro Crime Stoppers at 1-866-7-LOCK-UP. Thank you.
Thank you, Mr. Commissioner. And I think this is a moment where we need everyone to get involved. I want everyone to understand. We had a 15-year-old shot last night in the head in Park Heights. And I want everyone to understand how serious that is and know that that could have been anybody. For me, that one was particularly chilling because I spent a lot of time in the 5100 block of Charles Grove Road. I was in houses in that block. Now imagine what the world would have been like for my family if that would have happened to me when I was 15 years old. And it could have. And what we all have to understand, that these aren't numbers, these aren't a bad week, this is a lifetime, a community, people that will forever be shaken by what happened there. These are their family members, their friends, the people they went to school with, the people they work with will forever be shaken by what happened there. And we know, as you heard from the commissioner, again, this is why we were making that announcement on Wednesday about the flow of illegal guns into our city. This is why you continuously hear us talk about the work that the police have done to go after those who continuously commit violence in the city of Baltimore. But it's not just about that. It's deeper than one agency. This is why you've heard me for many moons tell that everybody that says they love the city and considers themselves an adult man or woman, that they mentor a young person in Baltimore City. That could save their life. Having that caring adult, not understanding what these young people are going through, and not having someone that they can lean on, not having someone that they can get to help pull them up, that can save a life in the city. We see a lot, don't tweet, don't Facebook, don't put it on Instagram. Figure out how you can help. There's young people crying for mentors throughout the city of Baltimore. We need everybody to step up. I'm going to hold all of our agencies accountable for what's going on and shifting to this virtual world, we also have to understand the impacts that that has on our young people as well. And this is why we also need people, adults mainly, to act right so that we can get back to a sense of normal for them. This is why I'm pushing us to be better so that we can do things like open up our rec centers and opportunities for our young people, while we are trying to do things differently to better support our young people and our families. But we need everybody. This should not continue to happen. We need people to get back to the old school, checking on young people, seeing where they are, so that they're not out roaming around the streets at 9:30, 10 o'clock at night during the weekend. We need levels of accountability that we used to have as a community that we don't seem to have anymore. Yes, I'm going to be responsible for holding the city agencies accountable, but it's also about how we can grow better as a city, to not just accept and say, oh man, that's messed up, little shorty got shot, and then we just move on. Because I can't move on from that. I always remember that, because that's somebody's child. And with that, we're going to be quiet for now and take a few questions. Who's first?
Mayor, dealing with the shootings involving the children. As a city councilman, and you were pretty much involved in a lot of mentoring programs and things like that, can you talk about what you, as mayor, I know you've taken on a lot of other responsibilities. What types of things, you used to go out bike riding, all kinds of things like that. What types of things are you trying to do now as mayor in terms of showing how you're leading as a mentor?
Yeah, I think that, one, I continue to spend a lot of time with young people, Barry. Actually, I don't really raise my voice a lot, but I raised my voice a few weeks ago with my staff because I wasn't spending enough time talking to our young people. This morning, I think I've been in about 4 or 5 Zoom classrooms this week and spending hours with our young people, letting them talk to me, letting them ask me questions. And some of the things that I get asked during those would shake people's mind. I had a young man ask me today about how I dealt with struggle in my life, or when I wanted to give up, or some bad happened, and did I just want to walk away? And he said to me openly that I have those kind of struggles. And I said to him, it's okay to have that. And it's okay for you to say that. It doesn't make you less of a man because you're asking for help. It makes you more of a man because you're asking for help. But Barry, that's why everyone needs to do it. Because some of these young people are not going to have that at home. They're not going to have an adult in their life. Some of the young people that I've mentored over the years, myself, my friends, the other folks around them, were the only caring adult that they ever would see outside of school. That's why we continue to push that. We know we announced our Children's Cabinet plan this week that talks about mentoring and the importance of that, and you'll be hearing more about how we want to bolster mentoring in the city. But it's about spending time, not just money, but time with these young people. Alexa?
Hello. I don't want to assume the executive order is that lifting the ban on the adult entertainment specifically.
So Alexa, as I said earlier, we make adjustments to executive orders as we always have done based on the information and science and data that we have, and we're going to enforce that. We're going to enforce that on every single person, every business, just like we have done, and that's how we're going to move forward. We make those decisions based on discussions that the Health Commission and I have, and we're going to move forward from there.
Yes, I understand that. I was clarifying that is what is changing today.
Look at the executive order. It's just talking about businesses that operate under specific kind of things. We know we're going to move forward based on that. We're going to do the enforcement. Next question.
What made you change your
question.
mind?
Next question.
What made you change your mind?
Next question, Alexa. You can't just ask 3. The man's waiting there. We can come back to you.
I shouldn't have to ask to clarify, but I did. Every press conference, you usually say what the changes are.
We've already given you a statement about the changes. I've talked about the changes with you already today. We've already done that. Next question.
So you're not going to answer what made you change your mind?
Next question again.
Okay.
Thank you.
Will you get any chance to talk to President Biden when he's here next week? And if you do get that chance, what would you bring to the table with him? Because obviously Johnson & Johnson, as the health commissioner pointed out, has raised a lot of new possibilities. Now we have the convention center with the 6 zip codes trying to help Baltimore. What does that present hope that he's here next week, and what would you go with?
Great hope, thank you, and thank you for the question. Yes, it would be much like what we said to the Vice President when myself and African-American mayors were on a call with her recently. It's about the importance of zeroing in on equity. It's about the importance of helping out cities directly. We know that the President Biden, and Vice President Harris understand the importance of cities and how they've been impacted. They also understand the importance of Black and brown and poor communities and how they've been impacted, and really just impress upon him things that I know and that I heard myself personally from the Vice President about how they're going to be focused in that way, because we know that if this country is going to come back stronger from this pandemic, that has to include a focus on cities.
One quick follow-up. The Latrobe homes, this week we want people to get tested more there. Certainly they had a reason to because of the wastewater samples that were done. Did we get a good reaction there? Were there any positive counts? Did that program work? This may be for the health commissioner, might be for yourself,
Yep,
whoever's.
I'll let Dr. Jiraza talk about that.
Sure, I guess just to briefly describe, this is a partnership with HABC and the Maryland Department of the Environment to look at wastewater from specific housing units across the city. And specifically saw elevation, and we always said that if we ever saw elevation, we would host a free testing event. So we did host that the Tuesday through Thursday, advertised it to the residents, answered any questions they had, and we did see a pretty good turnout for that.
Were there any positive results?
So that's not something I can share publicly, but thank you for asking.
Thank you.
Barry?
Also for the health commissioner, you talked about contact tracing and the contact tracing efforts.
Yes, sir.
I know before we talked about them in terms of you were trying to get people to answer, and how is that going now? Has that changed in any way in terms of getting more people to get involved and help out with that information?
So we still have our team calling. We've seen some improvement, but would still strongly encourage folks, and I know it's hard because it's a number you don't recognize. We would never ask information on your Social Security. We would never ask credit card information, but please pick up. Usually it'll say MD COVID, but we still want people to pick up.
Mayor, the Baltimore State Senate delegation has agreed to hold a hearing regarding the Hopkins police force issue. Where do you stand on that, and are you in support of revoking authority?
So the bill that they have is for revoking no authority. So what I would say to you, Emily, is that I have had no discussions with Hopkins or the Senate delegation about this piece of legislation and have not been involved in this really since it came up a few years ago. My last understanding is that Hopkins was looking at a kind of a reimagining public safety thing that they were doing, and we'll follow up directly with the delegation and follow up with you after that. Thank you. Thank you, everybody.